Arden GEM CSU is one of the largest commissioning support units in the country. We have a transformation team that works with commissioners and providers to design and implement change. Coming Home is about supporting people with mental health challenges to return closer to home for treatment and support into recovery. Our story starts in 2011. Working with Coventry and Warwickshire Partnership Trust and local clinical commissioning groups, Coventry and Rugby CCG, South Warwickshire CCG and Warwickshire North CCG, we recognised an over-reliance on out-of-area provision for mental health patients in our locality. Large numbers of patients were treated out of the area. They were a long way from family and friends, drifted and not connected to local services. There was a lack of robust clinical review of placements. We also recognised that less than 50% of the budget was spent on local services, and our local providers were not really geared up to supporting people with complex needs. This heralded the start of the mental health repatriation project, Coming Home. Working collaboratively, our objective was to design and implement a scheme which would reduce costs, but more importantly, would improve services for local patients. How did we start the programme? It was about engagement. We focused on setting the tone of our relationship. Designing and implementing a successful progress required collaboration across all the commissioners, our local authority colleagues and the Mental Health Trust. We established our terms of engagement. How would we work? How would we problem solve? Ownership of the whole process had to be by all parties. We weren't about blaming each other if things weren't going to plan, but trying to identify what we could collaboratively do to address them. We put patients very much at the heart of everything that we did. We used a clinical quality incentive scheme to wrap financial incentives around the project. We also used an NHS change model as a checklist for progress and to ensure that we were really focusing on shared purpose and a process of change. The first key point was that we recognised that the entire system needed to be reviewed. We needed to understand how patients had ended up out of area, how they'd been tracked and monitored from local services, or how they had not been tracked and monitored by local services, what the incentives were in the system to support people and bring them back into area. It wasn't about blame, it was just about understanding what had happened. We needed to move on. We recruited an experienced clinical review team from mental health nursing, occupational therapy and social care. They took full responsibility for all of those individuals who were out of area and started to pull together a list of patients and work through a comprehensive and transparent repatriation framework. There was proactive case finding. Red, amber, green rating of patients was undertaken to identify how long people had been there, what was their readiness for review, potential readiness for return. Detailed clinical assessments were undertaken of individuals, tracking whether they could start to come home soon, whether they were medium term, or whether there was still a lot to be supported in their treatment plan. The views of patients and their families were considered. This was extremely difficult in many instances, as individuals had been out of area for significant periods of time, so there was anxiety. And in many cases, it would take many months to bring people to a point where they were keen to return and for families to sort of accept that that was the best direction for people. There was a robust clinical scrutiny process put up, internal with mental health clinicians and external with commissioners, a real confirm and challenge approach. Every potential return to local area was considered very positive from a patient's perspective and actually explored how local clinicians could really support that individual. Progressing the programme, how did we do it? Our philosophy was about supporting recovery. We were working with people with very complex needs, who for many had been out of the area for many years. It was important that they felt confident and supported before making their move back into local services and their local home environment. We undertook regular reviews to monitor improvement and support people to the next stage of their journey. This involved family and friends, as well as all the clinicians and workers wrapped around them. In order to support people back into the local environment, we recognised the need to redesign local services. The Mental Health Trust undertook a lot of work to redesign their infrastructure in order to support people with more complex needs. Clinicians recognised the role that they played in supporting people back into their local services. So they might come through the local NHS Trust and then transition into independent providers for ongoing support. This was a really key part of people's journeys. From the CCG perspective, they recognised that this was a piece of work that had to be done across the whole of Coventry and Warwickshire and was not postcode focused. So there was a framework for sharing the savings and recognising they were all part of that. Such was the success of the programme that after a period of time, there was an expansion to a wider cohort of patients. We started very much with adults with mental health needs. That was our real initial challenge. There was a real focus and success in that area. We moved on to older people, including those with dementia, particularly after family members had approached the local trust, having heard about the programme, to say could their loved ones be moved closer to home. And we're moving now on to people with learning disabilities and complex needs. That has served particularly well following the Winterbourne review and the need to support people out of hospitals. The Coming Home programme has delivered many positive outcomes. Over 100 people have been repatriated and many more have had their care packages adjusted to ensure their current needs are being met. This is really crucial to ensure that their recovery trajectory is on target and that if people are still out of area, that they still have the goal of being returned to local services to continue their treatment and transition into local services. Over £12 million of cost savings have been delivered for the 3 CCGs, with new costs avoided by ensuring best use is made of local providers and local services. Many patients benefit from being closer to friends and family, with support to help them become part of their local community. This is a key part of their recovery and move towards independence.
I was in hospital for about 3-4 years. And my dad, he used to go and see me every 2 weeks. Now he comes like almost every day almost. St Andrew's is a massive place. I hated it. I really did hate it there. When I came here, I was over the moon. I thought it was really good. Yeah. And now I've got my own place. I think it's fantastic. Well, this is a brilliant place. I love it here. I keep it clean. Do basic living skills like cook for yourself, clean. I do speech and language therapy. I go to gym sometimes. It feels like I'm finally getting back to normality. Just can't wait for people to come and see me. You know? I don't know how to blow my own trumpet, but I think I've become a lot better since I've been moved into my own house. I'm hopefully not be in a place like this for the rest of my life, but I want to have more freedom. That's what I want next. And now I'm being given the opportunity to have my own flat. I know that hopefully I'll keep the flat.
I live at Tyre Hill in a care home, residential. I wanted to come back to Coventry because my family are here. I've seen my sister's boyfriend. I've seen my nephew as well. And my granddad and my mum. They let me see my family more or less every day. So I enjoy being in Coventry, like have a cup of tea around my nan's and stuff. That's the best part about it. It's a brilliant care home. I've got my freedom as well. I go on the bus and stuff like that. Got some second-hand shops. Have a wander around. It's really nice up here because you can walk and get fresh air and stuff like that. It's very good. So I'm quite happy living here at the moment, you know, like there's a plan behind it to get me to move on from here eventually. So we'll see how it goes. But I like being with other people. I don't like being alone. Nobody likes to be alone. Everybody wants to be wanted.
My name's Pam. I live in Kyneton in Warwickshire. I met Keith in 1979 and we moved here and we've lived here ever since. He drove a taxi in Stratford and then all of a sudden he couldn't count his money. We used to sit on the floor practising counting money so he could give change in the taxi. And then I thought, why can't he suddenly give change for a £10 note? And from then we had 2 years of assessments, memory clinics and things like that, and eventually they said he'd got dementia. I had so much care and support, it was unbelievable. Somebody came into the house to look after Keith so I could have a break, which was brilliant because otherwise I couldn't get out to see grandchildren or anything. But this one particular time he got really, really aggravated. This carer called the police. This was like 4 days before Christmas. So it was just awful. So so they took him away, kicking and screaming, literally, to St Matthew's in Northampton. That was just horrendous. They said that he would be there for like a month for assessment and then he'd be able to come home, but he never ever came home again. They wouldn't let him come home. Suddenly there was talk of arranging a review with a consultant from Warwickshire, and how did I feel about perhaps moving him back to our area? And he's now back in Stratford. So much easier. I think it's a fantastic idea that people are able to come back nearer home. Keith gets to see me far more, we get better time together, and it's so much less stressful for me.
Moving forward, what are our future developments? We're continuing to assess patients, including those with learning disabilities and dementia. The clinical review team now also assess people in local provision, including residential and nursing homes. We recognise that some of those individuals have really moved on and progressed, and yet we haven't necessarily supported them to the next stage of their recovery. The Mental Health Trust has redesigned its infrastructure to really avoid people going out of area and support their transition back into local services. And we continue to ensure that all patients receive the most appropriate care in the right environment. On those rare occasions when people need to go out of area, the first thing that we try to do is to say what's the trajectory and the plan for coming back into local services. So they're going out for a real focus and purpose and coming back for the remainder of their treatment. So how do you replicate the success of coming home? The first principle is that it's patient-centred. Patients were at the heart of everything we did. A case-by-case approach needs to be taken. Patients progressed based on clinical need. Partners recognise that they may achieve more cost savings in one year than another. It's a partnership approach. Local nursing homes and residential care homes are key partners. A steering group regularly reviews what is working well and areas for improvement. And we stand collaboratively as commissioners and providers to deliver real change and improvement for our local patients. So what are our key learning points? Ensuring alignment from all key stakeholders, establishing that real shared purpose. Detailed financial tracking and reconciliation. It's all about the patients. If everyone's committed to this principle, you'll overcome any challenges and barriers along the way. Thank you for listening.